Hi, hello, welcome. Morphologically, cranial nerves can be classified into three different varieties: oculomotor, trochlear, abducent, and hypoglossal nerves supply muscles derived from cranial myotomes. These are the muscles derived from cranial myotomes, occipital myotomes, and preoccipital myotome. Preoccipital myotome gives rise to muscles of extraocular group supplied by cranial nerves 3, 4, and 6. Cranial number 12 supplies occipital myotomes, which develop into muscles of tongue. Cranial nerves 5, 7, 9, 10, and 11, they supply muscles derived from branchial arches, which develop in pharyngeal arches. Cranial nerves 1, 2, and 8, they are associated with special senses. How morphologically these are classified? To understand this, we have to look at the location of nuclei of all these nerves in brainstem. Let us observe. This is brainstem showing nuclei of different cranial nerves. Observe here, this is oculomotor nerve nucleus, trochlear nerve nucleus, abducent nerve, and hypoglossal nerve. All these being general somatic efferent, they lie in line from midline to medulla. Oculomotor and trochlear, they are situated in midbrain at the level of superior colliculus and inferior colliculus. Abducent is located in pons at the level of facial colliculus. Let me now discuss on cranial nerve number 3, the oculomotor, the meaning which moves the eyeballs, oculomotor. These are the learning objectives for the session. Mention the functional components of oculomotor nerve, explain the nuclei and intracranial course of oculomotor nerve, extracranial course of oculomotor nerve, branches and distribution, and enlisting few related applied anatomical aspects. Let's begin. Functional components of oculomotor nerve are general somatic efferent, general visual efferent, and general somatic afferent. General somatic efferent component is for extraocular muscles and levator palpebrae superioris. Not all the extraocular muscles, will come to it. General visual efferent, that is preganglionic parasympathetic component for constriction of pupil and for accommodation. General somatic afferent is for carrying proprioceptive fibers from most of the extraocular muscles. These neurons are located in mesencephalic nucleus of trigeminal nerve. This is transverse section of midbrain at the level of superior colliculus. At the same level, motor nucleus of oculomotor nerve along with Edinger-Westphal nucleus, which is parasympathetic component of the same nerve, are located. The nerve fibers from both these nuclei turn forward, they convex laterally, they pass out through red nucleus and medial part of the substantia nigra and emerge out of the front of the cerebral peduncle in between both cerebral peduncles. Here we see at the upper border of the pons from the midbrain in between the cerebral peduncles, we are observing oculomotor nerves of either side coming out. Once it comes out of the midbrain, the relations immediately to it are these vessels. This is basilar artery, which terminally divides into posterior cerebral arteries. Just before that, it is giving superior cerebellar arteries. In between posterior cerebral artery and superior cerebellar artery, there lies oculomotor nerve. Nerve takes entry through the dura mater into cavernous sinus. This is where it is lying in cavernous sinus. Then after that, it passes into the orbit through superior orbital fissure. Let us look at its relations when it is in cavernous sinus. Here it is. Oculomotor nerve lies on the lateral wall of the cavernous sinus just above the trochlear nerve. Further to cavernous sinus, oculomotor nerve passes into superior orbital fissure. Then through the tendinous ring of Zinn, which gives origin to most of the extraocular muscles, it takes entry into orbital cavity. It divides into superior and inferior or upper and lower divisions. Upper division supplies superior rectus and levator palpebrae superioris. Lower division supplies inferior rectus, medial rectus, and inferior oblique. Let us look at it from front. These are the upper and lower divisions of oculomotor nerve. Upper division supplying superior rectus and levator palpebrae superioris. Lower division supplying medial rectus, inferior rectus, and inferior oblique. Among these, inferior oblique is the longest branch, which is here supplying inferior oblique. The same nerve carries the preganglionic fibers to ciliary ganglion, which is here. However, superior oblique and lateral rectus are supplied by trochlear nerve and abducent nerves respectively. This picture shows how general visual efferent fibers are arising out of Edinger-Westphal nucleus, and they are coming out through the oculomotor nerve. They are going to inferior division, that too branch to inferior oblique, then they are given to ciliary ganglion. From ciliary ganglion, postganglionic fibers reach the constrictor pupillae and ciliary muscles for pupillary constriction and accommodation reflex. Complete denervation of third cranial nerve on one side can produce ptosis, that is drooping of eyelid, because of paralysis of levator palpebrae superioris. It can also result in lateral squint because of unopposed action of lateral rectus. Dilated and fixed pupil can be seen, loss of accommodation will be there, protrusion of eyeball and diplopia are other features. Vascular lesions of the midbrain can result in Weber syndrome and Benedict's syndrome. Weber syndrome is because of involvement of this part of the crus, which shows ipsilateral motor neuron palsy of oculomotor nerve and contralateral upper motor neuron lesion because of involvement of pyramidal tracts. Benedict syndrome also shows ipsilateral oculomotor nerve lesion and contralateral associated symptoms of spinal lemnisci, trigeminal lemnisci, and medial lemniscus involvement.